Hi, my name is Becky Brond, and I'm a physical therapist and pelvic health specialist at New Life Physical Therapy. Today, we're going to talk about our breathing patterns. Not many of us really stop to think about the way we breathe, but that's exactly what we're going to do right now. There are a lot of benefits to breathing diaphragmatically. Okay, the top 3 reasons that I use them with my patients is 1, our diaphragm is part of our inner core muscle group. So by breathing diaphragmatically, we're kind of setting our muscles up to be more efficient and our core to engage a little bit more automatically and respond, which is what we really want out of our core. The second reason is that breathing diaphragmatically also sets a good negative pressure system within our lower abdomen, which helps with bowel and bladder function. And 3, breathing diaphragmatically really helps calm our autonomic nervous system, which again is really important for my patients who have urinary urgency issues, people who have a lot of anxiety, and even people with chronic pain. So lots of benefits. So how do we breathe diaphragmatically? All right, usually I start my patients out by saying place a hand on your chest and a hand on your stomach. And you kind of want to just breathe and kind of see, where is that movement coming from? Do I see a lot of my top hand moving where my chest and shoulders are doing all the work, or do I feel my bottom hand doing most of the movement? If it's the bottom hand, then you're breathing diaphragmatically. Ideally, what happens is our diaphragm is a muscle that sits underneath our rib cage. It sits like a dome or an upside down U. And what happens is when I take that breath in, that diaphragm should contract and flatten and drop down. It's attached to our lungs, so our lungs are moving in a downward fashion with it. But again, what you feel is more like your belly's filling with air because of the negative pressure system that it's creating. As we exhale, then that diaphragm kind of recoils and goes back into that dome shape. The interesting thing is, again, when you think about that feeling of that belly filling, you're getting your ab muscles to relax a little bit, they're lengthening, and if you really focus on your pelvic floor muscles, they're getting a very subtle dropping. So that's kind of the key. Diaphragm and pelvic floor are kind of working in conjunction, kind of like a piston, where when we take that breath in, it drops down. As we exhale, they passively recoil back up into their resting levels. So other cues I like to give is, again, imagining a beach ball or a balloon in your belly. So when I take that breath in, I'm blowing up that beach ball, and as I'm exhaling, that beach ball deflates. Or thinking of that lower rib cage as like an umbrella. When I take that breath in, my umbrella is opening 3-dimensionally, and as I exhale, my umbrella closes. All right, so don't get frustrated if you start trying this and you can't feel this happening. It takes time, it takes practice, but think of those cues and try to do it a couple times throughout the day. Take 5 to 10 nice diaphragmatic breaths. And again, lots of health benefits from it. Thank you.